Alrighty, so we just learned this morning about the Medicare.gov Plan Finder. And before we move on to our next section, for those of you who have the large volunteer manual that I sent in the mail, another good reference is in the back of section 3, starting on page 123. There's actually a print screen guide, and I'm not sure if Shannon mentioned this or not, so if she did, I apologize, but I'm just reiterating. Starting on page 123 is a print screen guide of how to go through the Medicare.gov Plan Finder. In case you're working on it and get stuck at one of the sections, you can reference back to that to kind of see how to progress forward. But without further ado, for those of you who have the big manual again, we are going to turn to section 7, and we're going to start talking about the Low-Income Subsidy and Medicare Savings Programs. For those of you who don't have the large manual, and I was able to send you the PowerPoints a couple days ago before the training started. This is the PowerPoint that's labeled LIS and MSP. So LIS and MSP is short for the Low-Income Subsidy and Medicare Savings Programs. All right, so what is low-income subsidy? More often than not, you're really going to hear it referred to in the SHIP world as extra help. That's kind of the lingo that we use here at SHIP is extra help instead of low-income subsidy or LIS. Although all three of those mean the same thing. You do the application through the Social Security Administration, and there is an online way to do that. That's much easier than doing it paper form. We won't be able to do a demonstration of the online application because I won't have any information to actually do a demonstration, plus it would include having to have people's Social Security numbers and things that we don't want on the training. But extra help is specifically for people with low income and low resources. And when I say that, I'm going to show you here in a couple slides the definition of the income and resource guidelines so you know what that low income actually means. And if people qualify for this program, they pay little to no premiums for their prescription drug benefit, no deductibles, and extremely small copays. So Shannon gave you a little taste about what those copays would be when she showed you the plan finder and said that the beneficiary had assistance. There are some categories of the extra help program where you might just have a reduced deductible at a little bit more out-of-pocket expense, but you're still not going to pay the full cost like you would if you didn't have any assistance. And personally, I feel the best benefit about qualifying for extra help or low-income subsidy is you are exempt from the donut hole, meaning you will never fall into that Part D drug plan roller coaster that we talked about yesterday, where you're responsible for 35% of the cost of your brand names and 44% of the cost of your generics. You're exempt from that and still pay those smaller copays. So some people automatically qualify for the extra help program. They don't have to apply for it. They're automatically going to get it. And these are people who currently have Medicaid in our state, or also referred to as TennCare, but they qualify for one of the categories of Medicaid. They're currently receiving Supplemental Security Income, or SSI. We talked about Social Security Disability Income yesterday. That helps you get Medicare. In order to get extra help, you have to have the SSI, Supplemental Security Income. So those are two different incomes. And the last one, if the beneficiary qualifies for a Medicare Savings Program, QMB, SLMB, or QI1 that we're going to talk about next, they're automatically going to qualify for the extra help program and get that assistance to help pay for their medication. Like I said, you can apply online at socialsecurity.gov. That's going to be the easiest way to do the application. It takes about 10 or 15 minutes, depending on how many times you've done it. You can also call Social Security, but we prefer that you, if you're not comfortable doing the application, you refer that on up to your regional coordinators because we have a grant through the Administration for Community Living, who also is our funder. That's a test question, by the way, who oversees the SHIP and SMP programs. It's the Administration for Community Living. They provide us a grant to help complete these applications for beneficiaries across the state. So if we do those, we get some credit toward one of our grant goals. So here is the income and resource limits for 2018. The resource limits and income limits aren't released until about February or March of every year. So we will be using these income and resource limits a little bit into 2019. But once they are changed, we will be sure to get you that information so you know what the new guidelines are. So to qualify for extra help or low-income subsidy, you have to be below 150% of the federal poverty level, which is the equivalent of no more than $1,518 for an individual and $2,058 for a married couple. We know that there are more than just single individuals and married couples out there. We know we have individuals who are on Social Security disability who have children. So it is, that income is based on the family size, and we do have the income guidelines for a larger family size if you ever need those. We can get those for you, and they're actually in your big manual as well. I believe it's up to a household of 6 you have in some of your resources. Speaking of resources, an individual can have up to $14,100 in resources, and a married couple can have $28,150 in resources. And when I talk about resources, I mean things like your checking account, savings account, stocks, bonds, mutual funds, property, things like that. It does not count the home that you currently live in or the car that you currently own. Those do not count toward those resources, but anything else pretty much does. Those figures, the $14,100 and the $28,150, includes $1,500 per person for burial expenses. Now, an important distinction is this $1,500 has to be kept in a separate account in order for it to count toward funeral or burial expenses. Okay. So if you meet those income and resource guidelines, yes?
On the burial expenses, if someone has a burial life policy, how does that qualify or get considered?
Good question. So anything that's like a life insurance policy or a burial life policy, cemetery lots, revocable or irrevocable burial contracts, things like that, in terms of resources, they look at the cash value. So if you're not able to pull any cash value out of any of those resources while you're alive, then it wouldn't count toward a resource, but you still have to prove that you have that with some documentation. So they only look at that cash value. Good question. All righty, so if you meet those income and resource guidelines, what does that get you? A lot of good stuff. It's going to reduce your Medicare Part D premium by $30.62. So think of that as, we'll round it up to about $31. It's about a $31 a month stipend to pay for your Medicare prescription drug plan premium. Yesterday we talked that the lowest premium in Tennessee is $17.70. I have $31 a month to go toward that premium. I may have a premium-free drug plan, which would be awesome. On the flip side of that, however, if my drug plan was $40 a month, I'm going to subtract the difference, which would be, what, $8.38? That would then become my premium for my prescription drug plan. So it factors out that $30.62 a month stipend. So you're getting some assistance there. Your copays for your medications are reduced to no more than $8.35 for brand name medications and $3.35 for generic medications. So yesterday I mentioned a medication called Capaxin, and it was a specialty medication that was like $5,000 or $7,000 a month retail cost. If a beneficiary was on that medication and qualified for extra help, the maximum he or she would pay would be $8.35. That is life-changing. Generics can be as high as that $3.35, but depending on the generic, it's usually no cost or even lower than that $3.35. You have no drug plan deductible. So if the plan initially, if you don't have extra help, says you have a $405 deductible, you qualify for extra help, that deductible goes down to zero no matter what. And we talked a little bit earlier, you're exempt from the coverage gap or the donut hole, which personally I feel is one of the best benefits that Extra Help has for our beneficiaries. And you may also not qualify for full Extra Help and get all of those benefits, but you may be eligible for 25, 50, or 75% assistance or a partial Extra Help. That would decrease your costs, but you would still have a little bit more to pay out of pocket. So we talked about applying. There is a paper application, and I'm actually going to show you the paper application here soon so you can see what kind of questions are going to be asked on the online application. So you can do really either one. I strongly recommend the online application if you're in an area that has internet access. I mean, that can be troublesome in some of our more rural counties if you're out in those areas. So I do carry some paper applications with me. So if I am in one of those rural areas and I want to talk to a beneficiary about applying for one of these programs, I'm able to fill out the paper application, and then I can go home or back to the office, and then I can complete the application online so it can be processed a little bit faster. And like I said earlier as well, we encourage you to keep the applications within the SHIP program and help us get some credit toward our grant that we have. Another really good benefit is that you can apply on someone's behalf. So this program really it's not going to hurt anybody. So if I get a daughter who calls and says, my mom needs help paying for her medications, and the daughter has all of her mom's information because she may be, you know, her caregiver, I will get the information from the daughter, and I don't need the mom's permission because I know that this is going to go to help her and not harm her. We did have a question come in. Do we tell clients that they wouldn't qualify for LIS, or will you help apply for anyone that wants to try? It's my rule of thumb personally that if anyone says, I want to apply for the Low-Income Subsidy Program, I do the application. They could be, especially if they're really close to that $1,518 limit, like if they're anywhere within $100 of that, I will do the application. It's not going to hurt. It's really important for us to make sure the beneficiary is aware that we don't make the determination if they qualify or not. What I like to say is, based on the information that you told me, it seems like you fall within these income and resource guidelines, but Social Security Administration is the one who makes that final determination. So we'll complete the application, and it usually only takes Social Security about 2 to 4 weeks to process the application and notify the beneficiary in the mail if they qualify for the program. So it's really not too long of a process. And I've had some beneficiaries only have about a week turnaround time in processing. So it gets done relatively quickly for that application. Great question. So you can apply for Extra Help at any time. It's an open application. There's no specific time of year you have to wait until. It's open all year round. And especially if someone is denied, say in January, and then something happens in September and their situation has changed and their income's dropped or something along those lines, it's good to reapply based on that changing of circumstance. So it's an open application. If you qualify for Extra Help, but then your drug plan is notified later, you may be able to get a refund of your deductibles, premiums, and any copays that you've paid. So let's say I applied for a low-income subsidy in August and I was approved, just notified that I was approved for Extra Help starting September 1st. Excellent, but I already got my medications in September. I already went to my pharmacy and they charged me $30 for my one medication, and it was really, with my Extra Help, it was only supposed to cost $8.35. I'll have to work with the pharmacy and my drug plan and get a reimbursement for the money that I overpaid, including the premium as well, with that $30.62 a month stipend that I received from the Extra Help benefit. Social Security does reestablish eligibility every year for beneficiaries, which is kind of like their renewal process. So they don't do it for every single person, but they do it for quite a few people, where the beneficiary will get a color-coded letter in the mail saying, For example, if you get a gray letter in the mail, that's Medicare telling you that you no longer automatically qualify for extra help. So maybe you lost your Medicare Savings Program, or you no longer qualify for Medicaid, or no longer on supplemental security income. Then you may get that gray letter with an application to reapply. Also, and that comes in September, so we should be getting those gray letters soon. So if people start asking questions about what this gray letter means, now you know. In October, it's a very festive orange paper comes in the mail in the spirit of Halloween that tells the beneficiary if your co-payments have changed. So this year the co-pays are $8.35 for your brand names and $3.35 for your generics. Next year those could go up or they could go down. So if that does happen, people are going to get notified in October what their new co-pays are going to be for 2019. Some of you on the call may have heard of the Medicare's Limited Income Newly Eligible Transition Program, or what we refer to as LINET. A lot easier to say, LINET, L-I-net. And what this program is helps people who don't currently have a drug plan, but who qualify for extra help get that assistance faster. So we talked yesterday that the only way to get a drug benefit is to enroll into a drug plan, right? So we have some beneficiaries who decide, I'm not going to enroll into a drug plan, risk having that penalty, but I can't afford it, so I'm not going to get a drug plan. We do the extra help application for them, and they qualify for extra help. That's great, but they have no drug plan to get that benefit from. So that's where this LINET program comes in. So it's a very short-term transition program to get beneficiaries that low-income assistance that they qualify for until they can get enrolled into a drug plan, and then the drug plan pays that benefit. And a lot of the times, the LINET program is discussed at your pharmacy counters. So a lot of our major chain pharmacies knows about the LINET program. Some of our mom and pop shops, we have gone out and done some outreach to them to tell them about the LINET program. It helps them get reimbursed as well. It's run through the Humana insurance company, and their number is right down here at the bottom of the screen. So it's really cool because it has an open formulary, meaning the medications are going to be covered. There's no networks of pharmacy restrictions, so as long as the pharmacist knows about it, they'll be able to use the LINET information to process the prescription. And there's really 3 ways to use the LINET program. Some people are automatically enrolled by the Centers for Medicare and Medicaid Services. So they see you don't have a drug plan, or that you qualify, for Medicaid or supplemental security income, and you qualify for that assistance, they'll automatically enroll you into LINET, and they'll automatically enroll you into a drug plan. For others who are not automatically enrolled, again, you would go to your pharmacy counter and ask about LINET, and the pharmacist can call using that number I showed you on the previous slide for Humana in order to process that medication. The last option that's probably going to be the most stressful and complicated for the beneficiary is the beneficiary can go to the pharmacy and pay what they pay for their medication, and then they can submit a receipt to the LINET program to be reimbursed. So it's going to be easier for the beneficiary to just have the pharmacist do it at the counter most of the time. And we do have more information on the LINET program that we can send out that's in addition to the information that you have here in your manual. So it's a really, really good program. And that's extra help in a nutshell. So before we move on to the Medicare Savings Program, does anyone have any questions about low-income subsidy? Because I'm going to show you the application here real quick for a little bit. Okay. There we go. I'm going to see if we have any questions that came in. Nope. All right, so I think I made that a little too big for this. So this is the paper application for Social Security, and it's kind of out of date. This isn't the 2018 paper application, but it does have the same questions that are on the online application. So again, this is kind of the last resort. We don't want to mail in paper applications if we don't have to, because they're going to get processed a lot faster if we're able to do it online. But we do have the beneficiaries out there that say, no, I don't want to give you my Social Security information, which is completely and totally legitimate. I understand that. I'd rather fill out the paper application and send it in myself, and that's perfectly fine as well. So it kind of gives you a lot of general information. The instructions on how to complete the application. If you are going to submit it or have the beneficiary submit it and they want to do it in a paper form, it's very important that they only use black ink and they don't use any other color to complete the form. So now we're getting to the questions. So this is where we have to get some personally identifying information from our beneficiaries. We do need, in many cases, their Social Security numbers, Medicare numbers, and things like that. So we're going to get the applicant's first name and last name. Any suffix is very important. John Smith, Senior, Junior. If there's more than one, we need to make sure we have that suffix. Their Social Security number and their date of birth. If they're married, we're going to need the spouse's information as well, because when you're a married couple, even though your spouse is not on Medicare, you are in a household of two, so they are going to ask for your spouse's information. It's going to ask you, these are in different income guidelines or resource guidelines, so that's why this is an older version of the application. But it's going to ask about resources. Do you have more than 20? Don't remember. Well, let me look back at my resources. Because see, you don't memorize these numbers. You have them in your resources. That's why I don't have it memorized. So let's see. This number, for example, should be $28,150 for a married couple, and then $14,100 for a single individual. If they say I have less than that, or no, I'm not more than that, then you would check the no, or place an X. Place an X in the box. Then you would ask them the total of their bank accounts, that's checking, savings, CDs, whatever they have would go in these boxes. All the stocks, bonds, savings bonds, mutual funds, IRAs, any investments are going to go in these boxes. Any other cash in the home. So I like to say, do you have a mattress full of money? Usually gets a couple of chuckles on kind of a serious topic. Would go in that box. Most of the time when I talk to a beneficiary, these boxes are never filled. I do get some information about their bank accounts, and I tell them just to give me kind of a rough estimate. You have to at least have $1. If they say I don't have any money, at least put $1 in there. Will this money be a source for those funeral expenses, yes or no? If yes, then you just skip to the next question. So I guess you only mark no if that money is not going to be counted toward the burial expenses. They ask you if you have any other home or property other than where you currently live, any other real estate. Number 7 is a pretty important question. Is there someone related to you by blood, adoption, or marriage that lives in the house with you and relies on 1/2 of your financial support? So in the case of someone who's married and has dependent children, they would put 2 additional people in their household because they have dependent children and they're related to them by blood. Or possibly adoption. You never know. Depends. So we mark an X in that too. If there's no one, if it's just that person, or if it's just that person and their spouse, then we would just mark it, put an X and 0. Then it's going to ask about income. So Social Security benefits, very important, before deductions. So many of our beneficiaries are going to tell us when we say, great, you're under that $1,518 a month. To do this application, I need to know your specific income. And they'll say, well, I get $1,200 in the bank every month. So they'll give you what's deposited. What's deposited is after deductions. So a good rule of thumb is if they give you what's in their bank account, be sure to add the $134 Part B premium that's being deducted. So I would really put in, if it was $1,200, I would really put in $1,334 to have their monthly benefit before deductions. They have railroad retirement benefits or veterans benefits, and these are monetary benefits. Any pensions or annuities or any other kind of income, alimony, rent, workers' comp, anything like that needs to be filled in to these areas or online electronically or marked none. Have any of these amounts decreased in the last 2 years? Yes or no? Have you worked in the last 2 years? If the answer is yes, then we have to answer questions 10 to 14. A lot of the times we're talking to beneficiaries who are either retired or haven't worked in a little while, so most of the time you may just have a no there. But if we have someone who's, worked a part-time job to try and supplement their income, then we have to ask them what they expect to earn before deductions in the this calendar year. So I try and say, how many hours a week do you work, and what's your pay rate, and then I try and do a quick calculation for a good estimate. Do you expect to earn any money from self-employment? If yes, then you kind of do the same thing and then estimate how much they're going to earn. Have any of those amounts decreased in the last 2 years? And if you've stopped working, so they say, have you worked the last 2 years? Yeah, I worked in 2017, but I haven't worked at all in 2018. Then you would mark 0 for the expected this calendar year and that you stopped working September 2017 here. Question number 14 is, do you have any, I'm basically summing up this paragraph, so I'm not reading it to you. But basically, do you have any expenses that help?
This is America's Health Today, brought to you by Erlanger.
All right, I think we were put on hold, so maybe I'm boring somebody, but muted that person. We had a question come in, where can we find a copy of this application? You can find it on Social Security's website, and I'm also writing myself a note right now to email this application to you guys. Again, it's not going to be the 2018 version. I'll do my best and try and find the 2018 version for you, but I will make a note to email this to everyone. Okay, great question. Let's see. So question number 15 is an important question as well, and as funny as this may sound, we pretend like question number 15 does not exist, and we just skip on past it. Because what this question does is it's going to send this application to the Bureau of TennCare to screen the beneficiary for the Medicare Savings Programs that we're about to talk about. So it's kind of a 2 application in 1. So what it's saying is, unless you mark no, we're going to send this application to your Medicaid office, which is the Bureau of TennCare in Tennessee. So unless the beneficiary says, no, I don't want any more assistance, which no one usually typically says that, we just keep on going because the application is automatically going to be sent to TennCare. So again, that's the reason why we kind of pretend this question doesn't really exist, because it's already doing what we want it to do. Lastly, if the beneficiary wants to do a paper application, they do have to sign. We cannot sign on the behalf of a beneficiary, but if you are doing it electronically, you can, it's an electronic signature that we just ask the beneficiary a simple question like, do you authorize me to submit this application on your behalf, and that all the information that you've given me has been truthful to the best of your knowledge. Usually what I ask the beneficiary. Or you can read this whole big statement if you really wanted to. That's on, this is also on the online application as well, whichever you're most comfortable with. And then you submit it. And you're good, and it takes, like I said, about 2 to 4 weeks for Social Security to process the application and get the beneficiary a notification in the mail if they are approved or denied for the benefit. Questions on the low-income subsidy application or any of its benefits? None? Okay. Great. Again, feel free to type in your questions or ask them out loud. But if there's no questions, I also want to point out in the big manual that many of you have and some of you will have soon, starting on page 247, there is a print screen guide of how to do the application I just showed you on screen with the paper form. It's kind of a step-by-step process of how you complete the application online. So same questions, maybe a little bit different order online than it was on the paper application, but there is a kind of print screen step-by-step guide on how to do that online for you. Okay, just double checking for questions real quick, and nothing has come in yet, but again, as I see questions, I'll answer them as I go. So we're going to switch gears and look at the Medicare Savings Program. These programs are administered through the Bureau of TennCare. So let me tell you about two of the test questions you're going to have this afternoon. One is, what federal agency do you go to apply for the Low-Income Subsidy Extra Help Program? And that, as we just talked about, is Social Security Administration. Now we're going to switch gears to the Medicare Savings Programs, these four programs listed on the screen, QMB, SLMB, QI1, and QDWI. These programs you have to apply through the Bureau of TennCare. So that's the second question, is what state agency do you apply for Medicare Savings Program? And that is the Bureau of TennCare. So we have these four programs, and we already talked that low-income subsidy is helping to pay for your Part D as in drugs, so your drug costs, your Part D premiums, your copays, your deductibles, everything for your medication. The Medicare Savings Programs help pay for your Medicare Part A and Part B expenses, your hospital and medical expenses. So QMB, qualified Medicare beneficiaries, SLMB, specified low-income Medicare beneficiary, qualifying individuals, or qualified disabled and working individuals. QDWI sounds like we're pulling over old beneficiaries drunk. So we're going to go through all four of these programs right now. Before that, how to apply? If you need it to obtain a paper application, beneficiaries can call the Tennessee Health Connection that is under the Bureau of TennCare at that number. However, I'm also going to send you the paper copy of the application, so you don't have to use that number if you don't want to. You'll have it as a resource for your disposal. Like we said, SHIP also has the application, so if somehow you lose the application that I'm going to email you, your regional staff also has copies at their office that they can send you electronically. To apply, you can mail in the application, but I really, really, really want to stress how important it is to fax in these applications, if you're able to. Many of you who, don't work in an office and you don't have a site that you're going to be at necessarily yet, we'll get you to a site soon, hopefully. You do one of these applications and you don't have a way to fax it in. We encourage beneficiaries to go to their local senior centers or have them mail back the application for us to fax in the application for them. The reason I say fax is so important is because when you fax something in, you get a confirmation that the Tennessee Health Connection or the Bureau of TennCare has received that application. Sometimes, normal human error. Sometimes when things are mailed in, they may not go to the correct department or they may get lost in the shuffle. So having that fax receipt that shows the proof that the Tennessee Health Connection received that application is very important in case something happens and something gets lost. We had a comment that DHS will fax them as well and give them a copy of the fax confirmation. Excellent. That's another resource in the local community as well. So we're going to look at some income and resource limits. So for QMB, our qualified Medicare beneficiary, or QMB, if you want to be cute, is below 100% of the federal poverty level, which is the equivalent of $1,032 for an individual and $1,392 for a married couple. Again, based on family size, and we have some resources in your manual. Starting, it looks like on page 270, that gives you up to a household of 4 in case you're interested and have some clients that have a higher household number. Now, you may look and do some research on your own, which I encourage you to do, that the 100% of the federal poverty level is actually $1,012. So what the Bureau of TennCare does is they allow what's called a $20 disregard to the federal poverty level. So we're able to get, $20 more a month per beneficiary to see if they qualify. So we're giving, what we give you is the maximum amount a beneficiary can make in 1 month. The resources are the exact same kind of resources we talked about with the Low-Income Subsidy Program. It counts your checking account, savings account, stocks, bonds, mutual funds, all that good stuff, but it does not count the home that you currently live in or the car that you currently own. Same rules apply for the $1,500 per person for burial expenses as well. And your resources go down. Resources are $9,060 for an individual and $14,340 for a married couple. So our income and our resources have gone down from what we talked about with the Low-Income Subsidy Program. Now, as we go through these other programs, the SLMB and QI1 programs, these resources are going to stay the same. And you'll see that as we go along. So what are the benefits of QMB? QMB is the creme de la creme of the low-income programs for our beneficiaries. Basically, QMB acts as a supplemental plan from the state of Tennessee to pay the 20% Medicare doesn't pay. It pays both Medicare Part A and B deductibles, the $1,340 Part A deductible and the $183 Part B deductible. That's paid for you. QMB pays the Medicare Part B premium. So the $134 that's taken out of your check every month, the state pays for that. And like we mentioned earlier, if you qualify for any of these Medicare Savings Programs, you get all of the benefits. You get the premium reduction, you get the copay reduction, you get no deductibles when it comes to your prescription drug benefits. So everything gets lowered for you. Questions on QMB before we move on to SLMB? I like to try and open it up for questions on the Medicare Savings Programs as we go through one by one. All right. So I'll keep going, but again, please feel free to ask questions whenever. So the next program is the SLMB program, or the Specified Low-Income Medicare Beneficiary. And those resources are between 101 and 120% of the federal poverty level. That's what FPL means, is federal poverty level. I told you not to memorize any of these numbers, but it's kind of hard to forget 1, 2, 3, 4 when it comes to the individual monthly amount, monthly income, $1,234. And then you have the married couple's amounts, which is no more than $1,666, which is an unfortunate number, but there it is. So those are probably two of the easier numbers to remember just because of what they are. And again, just like we talked about a little bit earlier, the resources are going to stay the same that I just talked about previously, so I don't sound too much like a broken record. QI1, so we're going to get into 2 income and resources back to back, and I'll tell you why I'm doing that here in a minute. So QI1, or qualified individual, can be between 121 and 135% of the federal poverty level, and that's a maximum of $1,386 for an individual and $1,872 for a married couple. Again, based on family size, that can increase, and then our resources are the same. Again, please don't memorize these numbers. We have brochures, we have your reference guide, we have all sorts of resources for you to refer back for numbers that you don't have to memorize those. So why did I tell you 2 income and resources back to back without telling you what their benefits are? Because their benefits are exactly the same. SLMB and QI1 pay for the Medicare Part B as in boy premium, the $134 that's coming out of your Social Security check every month. And it also gives you the benefits that we talked about earlier for the Low-Income Subsidy Program, the $30.62 towards your Part D premium, your lower copays, no deductibles, and you're exempt from the donut hole. So all of those things apply. People who qualify for SLMB and QI1 are responsible. They do have to pay the 20% Medicare doesn't pay and their Part A and their Part B deductibles. We do have quite a few beneficiaries who qualify for SLMB and QI1 that may lean toward a Medicare Advantage plan because we saw what their income levels are. I mean, they're on a fixed income. So a Medicare supplemental plan may be too costly for them or maybe too expensive, so they may lean more toward a Medicare Advantage plan. Some people are different and they want that supplemental plan. Again, as we counsel, I really want to stress that we are completely non-biased, and whatever the beneficiary is interested in, we just provide that education to them. Another unique thing that distinguishes SLMB and QI1 from one another is SLMB is going to be around forever. It's a federally funded program for all of the state's Medicaid offices. QI1, however, qualifying individual, that is a grant-based program. So every state is issued or allotted a certain amount of money. We don't know how much money is allotted. For people within the income and resource guidelines that we just talked about, would be eligible to get their Part B premium paid for and their Medicare prescription drug coverage assistance. Once that money runs out, even if you qualify based on your income and resources, you're not going to be able to get the benefit. So once the money runs out, the benefit kind of sort of runs out. So we don't know when we get the money, and we don't know how much we get. So if you think the beneficiary qualifies and you're not sure if QI1 has any money left in the grant, apply anyway. The worst thing that TennCare or the Bureau of TennCare, our Medicaid office, can say is no and deny the benefits for being over income, something along those lines. But that's the big distinguishing factor between those two as well. Next one is QDWI. And look at those incomes. Those incomes are super high. So before I tell you those incomes and what this program covers, we have to look at the name itself. Qualified, okay, that's good. Disabled, so right there should already trigger in your brain that in order to qualify for this program, you have to qualify for Medicare due to a disability. So you have to be under 65 and on Medicare in order to qualify for this program. So that's qualified and disabled. Working is the W. So not only do you have to be on Medicare because of disability, you also have to be working and being on Medicare due to a disability. And then individual is just yourself. So that's why our incomes are so much higher than the programs that we've talked about previously, with the $4,132 for an individual and $5,572 for a married couple, because you're allowed to be working, a working individual, and qualify for this program. But you can see our resources are pretty low, $4,000 for an individual and $6,000 for a married couple. So what benefit does our beneficiaries get from this program? QDWI pays for a beneficiary's Part A as an Apple premium. Now, some of you may be scratching your head because we talked yesterday. There's a very small, about 1% of the Medicare population actually pays a Part A premium because they haven't worked those 40 quarters and paid into the Medicare tax or the FICA tax. So it is rare that we have a beneficiary who needs the QDWI program, but it is there for a beneficiary who does not have enough work quarters Maybe it was a beneficiary who was self-employed who was never married, or a legal immigrant that came over later in life who is unmarried, and they're not able to get those quarters. So we do have some situations like that. QDWI does not pay the Part B premium, it does not pay the 20%, and it does not pay the deductibles. So the only thing it would pay is if the beneficiary had that Part A premium. All righty, questions on the programs, because those are the benefits. And next thing we're gonna do is we're gonna talk about that Medicare Savings Program application. So let me get out of this. This guy over here. I don't see any questions popping up yet, but again, please feel free. I don't see any hands raised, because if I see hands raised, I can unmute you if you're muted. So I'll probably get some questions as we go through the application. But this is the application that we use to apply for the QMB, SLMB, QI1, and QDWI programs. This is only available paper form. There is no electronic way to submit this application. And actually, it's been updated, I believe, this year or last year. So some of you may have older versions of this application or have seen it before and are going to notice some changes. So I will be sure to include this application in my follow-up email at the end of the day, along with the low-income subsidy application that we just looked at. So this application is for quite a few reasons. Many of you may have heard of or actually work for or interning at the local area agency on aging and disability, or the AAAD for short. Your area agency on aging and disability, they help screen and complete applications for the Choices program, or the long-term care services and supports. As SHIP staff and volunteers, we do not do the application for the Choices program. We're going to refer that to the area agency on aging and disability. What we're going to do is we're going to focus on the people who want help paying for their Medicare, like the QMB and SLMB programs. So who should apply for this? And it gives you all that information. We know anyone on Medicare who's within those income and resource guidelines should be applying for these programs. Here it has where you can mail or fax the application to. Again, if you can, I strongly encourage you to fax the application in, or work with your regional coordinators and get applications to them, or refer the beneficiary to them so they can fax in applications. Is someone helping you fill out these pages? You can mark yes if you'd like, or you can mark no, whichever. But please do not. No volunteer or staff should put themselves down as the beneficiary's authorized representative. Do not do this. Now, if you're applying for your own mother and you're the power of attorney for your mom, you may want to put your name down, for a family member. But for a stranger who you're just helping with their Medicare, who you met at a senior center or returning a call from, please do not put your name as their authorized representative, or else you're going to get the calls and you have to fill out forms and things like that. Don't want to do that. Starting on page 2 is where we really talk about the beneficiary. And I apologize, I know everyone can read, and if I just send you this application, you all can go through it and read it, and it's pretty self-explanatory. So I am going to be going over this application more in depth than I have some other applications or some other parts that we've talked about. So I don't mean to do that like you can't read it or you're not able to understand the application yourself, but there are a few things that I really want to point out. So bear with me, and hopefully I don't put you to sleep. Of course, we have the name, address, city, all that good stuff. Notice how in the first address, they do not want a P.O. box. So if the beneficiary gives you a P.O. box, we need an actual physical address here, but the mailing address can be your P.O. box. Here's where you put in your phone number. That's very important, because if the Bureau of TennCare has any questions about the application, they need a way to contact the beneficiary. Do you intend to be a resident of Tennessee? Yes. We are going to have some of our beneficiaries who are moving to Tennessee from another state, who may have Medicaid benefits in another state, but every state's Medicaid is different. So they could have Medicaid out in California because their income and resource guidelines may be higher in California due to the cost of living. And then they move to Tennessee and think, oh, well, I should be able to get Medicaid in Tennessee, but our income and resource requirements are lower and they may not qualify. So it is different state to state. Do you receive Medicaid benefits from another state? If so, which one? So you may get yes or no's on that. Do you want us to ask that state to stop your Medicaid? If they do have Medicaid from another state, mark yes. We do want TennCare to contact that other state to help get that benefit stopped. Because in order to qualify for Medicaid in Tennessee, your benefits from the state that you're moving from has to be canceled. You can't have Medicaid benefits in two different states at the same time. What's the best time to reach you by phone? Please do me a favor and don't put any time, because whenever you put any time, usually the beneficiary is not home. So I ask the beneficiary, is it better to call you in the morning, afternoon, or the evening? And then I'll put that in there. Because some of our beneficiaries like to sleep in, like many of us do who aren't able to. What am I using the application for? The only box that we as SHIP and SMP staff and volunteers should be marking is this middle one, the Medicare, middle one, not all three of those. The Medicare Savings Program to help pay my Medicare costs. That's the only one we should be marking. These other boxes could be marked by your local area agency on aging and disability staff, but not by us. We're just looking for that middle one. Going down a little bit more, they ask if you're homeless or if you're living in a shelter. That way they can get some information to you and figure out how to get it there. What language do you speak and read best? If you have a disability. When you ask a beneficiary if they have a disability, you could go down a rabbit hole. So what I do is I only ask, do you have a disability if the Medicare beneficiary is on Medicare due to a disability? So if they're under 65. And then I kind of specify it even more that what is the disability that Social Security deemed you eligible for your Social Security disability income benefit. So that kind of narrows it down instead of someone saying, yeah, I have back problems or I have arthritis, and kind of names a whole lot of stuff. Do you need help? Do you need TennCare's help filling out these papers? You can mark no because we're the ones helping. Page 3, tell us who lives in your home. So just like the Social Security application, your household should only be people who are related to you by blood, marriage, or adoption, and who rely on one half of the applicant's financial support. So let me give you an example. I am applying for a Medicare Savings Program. I live with my sister, and my sister does not have a job. I am paying all the bills, and she is reliant on one half of my financial support. I would put her name in this box because one, she's related to me by blood, and two, she's relying on me for half of her financial support. That's example number 1. Same example, but my sister does not need my assistance. She's paying her half of the bills. She's doing her thing. I'm doing my thing. We just live together. She then would not be included in my household because she does not need one half of my financial support. That's the second example. Another example, I'm living with my best friend from college. She relies on one half of my financial support. But I don't put her on the application because we're not related by blood, marriage, or adoption. So a couple examples to help clarify kind of the household. So you do want the first, middle initial, and last name, their date of birth. Only put in a Social Security number if the beneficiary wants coverage. So you definitely want to put in the beneficiary that you're applying for, Social Security number, how is this person related, and all that good stuff. So fill in the box as you can. Section 3, are you a U.S. citizen, legal, alien, immigrant? Yes. If no, then they're going to need papers. Any children living in the household? So these questions are more self-explanatory that I'm not going to go over one by one because you just kind of ask them and mark yes or no. Long-term care, temporary living out of state, all that good stuff. Military, property, all that stuff. What I really want to focus on that's really, really important when it comes to this application, especially for our Medicare Savings Program beneficiaries, is the top of page 4. What health insurance do you have? Including Medicare. So we need to know the name of the insurance company. Just put Medicare. It doesn't matter if they're on a Medicare Advantage plan, doesn't matter if they have a supplemental plan. That's okay. Make it easy on yourself and the beneficiary and just put Medicare. What's the policy number? Right now, a lot of our policy numbers are going to be the beneficiary's Social Security number with a letter after it, or they may have the new Medicare card with the new Medicare number. Whatever that policy number is or the Medicare claim number is on the red, white, and blue card. Again, does not matter what's on the Medicare Advantage plan card. We are looking on the red, white, and blue Medicare card. Put in that Medicare claim number or the policy number. Put in the beneficiary's name because they're the policy holder. Put in their Social Security number. Even if it is the same number as their Medicare claim number, put it in there again. Premium amount, make it easy on yourself. Just put $134 because that's your Part B premium. Again, doesn't matter if you have a supplemental plan premium or a drug plan premium or anything like that. Just put the $134. Make it easy on yourself. Another really important thing is to include both the Medicare Part A as in Apple start date and the Medicare B as in boy start date. Yes, even if it's the same date, put A being effective that day, B being effective that date. And what's the relationship? Self. You should not have to fill out this section because does another person also have this insurance? No one can be covered under your Medicare. Remember, Medicare is an individualized insurance, so you do not have anyone who is also going to be covered under Medicare. All righty. Now that I went over that, does anyone have any questions before we move on to proof of income? I want to allow plenty of time for questions and clarification. Okay. All right. So income, proof of income. So does anyone in your home work? That could be a yes, it could be a no. Depends on who you put in that initial chart up at, I believe it was number 2 of who's in your household. So if it's a yes, you have to provide pay stubs for 2 months for each job. The last 2 months of each job, you have to provide those pay stubs in your documentation. If you mark no, of course, there's no pay stubs to submit. If anyone's self-employed, you're going to have to provide federal income returns to the paperwork. And then it also asks who's earning the money, how many hours a week, how often do you get paid, what your pay rate is, employer name, employer number. So you do, if you mark yes, you need to fill out this chart. I've only had a couple beneficiaries I've had to fill this chart out for when applying for these programs. Is there an adult in your home with no income? Yes or no? When did it stop? This is one that most everybody marks yes, because does anyone get Social Security or SSI or unemployment payments? Most beneficiaries we talk to, Social Security income is going to be their only income. Whether that's retirement or Social Security disability, that's the only income they're getting. So we would mark yes and put their name. And looky here, we do not have to send proof of that income. So if all they're getting is a Social Security benefit, you do not have to provide any proof of that. They're going to link up to Social Security system and the IRS system and get confirmation and proof of your income. Did you lose Medicare because you went back to work to make more money? If so, yes. If not, no. And then if anyone gets any kind of income here that's in your household. Now, I really want to stress that these boxes, the name of the people, should only be the people that you put in the chart above that were listed in the household. So you don't have to put anybody else, only the people who you marked up here on number 2. So again, I live with my best friend. We're not related by blood, marriage, or adoption. I don't put her up in the household. I definitely don't put her in any other boxes. Okay, number 5, if you have a child, if you pay child care for a child or a disabled adult, you would fill in this information. I don't think I've ever had to fill in this box doing an application, but there are people who have disabled adult children who have that expense, so be sure to put that in there if that situation comes up. The big one that we get most questions about is number 6, to tell about your resources. So before we start this, please let me know if you have any questions before we move on. So the first thing they're going to ask is property. Tell us about the property in the space below, something that shows what the property is worth. I actually have never, I've only put in property that is more than, okay, I got to figure out how to say this. I do not put in the house that the person currently owns in their property because that's not considered a resource. So the only property that I put in this chart would be any additional property or real estate is what I put in that space. Checking accounts, savings accounts, Christmas club accounts, any of those needs to be filled in. So checking account is probably the biggest one that you should most all the time fill out. Bank name, regions, First Tennessee, whatever it might be, how much is in it, and the biggest thing, you have to provide statements from your bank or credit union. This is one of the big reasons why some people get denied a Medicare Savings Program is because they do not submit this proof of bank account. It's very, very important that you provide the proof or else the application can be denied. Cars and trucks. Again, I do not put the car that the beneficiary currently owns in there, but I do put any additional vehicles in the chart. Motorcycles and boats. Be careful. The motorcycle could be that beneficiary's only mode of transportation, so that would count as their vehicle. I had a question come in, and I'm in the same boat as this person. I did not know that these existed. But we had a question of what is a Christmas club account? So glad you asked. Some banks allow you to put a little bit of money into a Christmas club account. It is exactly what it sounds like. It's a little bit of money set aside for Christmas presents. I need to start one because I have 6 nieces and 2 nephews, and they are expensive little boogers, but I love them. So that's what a Christmas club account is. Good question. The next one, RVs or campers. Be careful on this one as well because their RV or camper could be the home that they currently live in. But if it's an additional recreational vehicle, then be sure to put that in there. We had a question that was, so if they have a car and a motorcycle, then you would add the bike. Yes. So the car would be considered their main mode of transportation, and their motorcycle would be considered a resource. Great question. Trust fund or estate, you've got to have the legal paperwork for that. Any of your stocks, bonds, IRAs, CDs, tax shelter accounts, any of those things, including your revocable or irrevocable burial contracts, cemetery lots. If you mark yes to any of those, you're going to have the proof to back it up. And then other, if you have any other kind of resources, the mattress full of money, the tin can buried in the backyard, you can put those in there for your resources. We also have the question of a life insurance policy, yes or no. Like we talked earlier, we had a question, what do they kind of look at, what counts toward that resource? We're only looking at that cash value. So you could have a $500,000 life insurance policy, but you're not able to draw any money off of it, and the cash value is zero. So then it would count as $0 towards your resources. But again, we need paperwork for that. Okay, only fill out, so that was Section 6. Section 7 on page 7. So you only need to fill out this part for long-term care, intellectual and developmental disability community. So when we look at these 4 bullets, none of them mention the Medicare Savings Program, right? So in that case, we get to skip number 7. Yay! Meaning we don't fill out the question of what health plan do we want, because we don't get a health plan. Like it says here, if you're only applying to help get your Medicare costs, you're not going to be enrolled in a TennCare health plan, so we do not fill out that section. So basically, we skip Section 7 and move right on to the signing portion. And again, we cannot sign for the beneficiary. The beneficiary has to sign for themselves, whether that is you're counseling someone at a location and they can provide their signature, or a lot of times here at the office, we can fill out the application for a beneficiary, but we have to mail it to them so they can provide their signature before we can fax it in. And then they date it, and then again, I'm probably stressing this too much, but if you can, I strongly encourage everyone to fax in the application along with the documentation to make sure it gets to the Bureau of TennCare and you get that fax receipt for proof. So this checklist is fun, and I'm going to make this checklist a whole lot easier for you because I'm going to tell you things that you do not have to provide. So there's about half of this list that we do not have to provide for the Medicare savings portion of this application. Now, the Area Agency on Aging and Disability that does the Choices program may have to provide everything on this checklist. But in terms of the Medicare Savings Programs that we are applying for, there's some things we do not have to provide. For example, number 1, you can mark it out. We do not have to provide ID, like a license or anything like that, unless with the citizenship question, if we say we're not legal, the beneficiary is not legal, then they have to provide citizenship. But 10 out of 10 times I've never had someone need to provide that. You do not have to provide your Social Security number or date of birth. Don't have to do number 1 or number 2. Number 3, however, is extremely important. I would highlight that and put stars by it because everyone needs to provide statements for the month of the application and 2 months before that. So we're applying in September. We need September statement, August statement, and July statement as proof of the checking account, savings account, IRAs, stocks, bonds, and 401ks, all of those for each account. We need 3 months. Life insurance policy, yes, you need to provide proof of that if you marked yes on the application. So we're going to leave that one there. Health insurance premiums, number 5, you can mark that one out. We do not have to provide the premium amount. Number 6, if you marked yes that you have other income, then you do have to provide income there. Vehicle registration, if you have additional vehicles besides the one that you're using, then yes, you do have to provide that. Same thing with property. You don't have to provide documentation of the house that you currently live in, but if you have additional real estate, you need to provide that documentation. Same thing with burial contracts. If you marked yes, you need to provide proof for it. Number 10, you do not have to provide any of the basic living expenses. You do not have to show proof of that. In terms of this application, they really only look at what's coming in for your income. They don't look at any expenses. Number 11, if you answered any of the questions about a dependent child, then yes, you need to provide proof of that. Number 12, I got to admit is my favorite, the names and numbers of 2 people so they can verify you are who you are. We do not have to provide that. I just really like that option. Kind of like a job interview. All proof of sale or transfers of any resources made in the last 5 years, you do not have to provide proof of that. So no to number 12 and 13. You do have to provide anything for cemetery lots if you mark that you had cemetery lots. And number 15, you do not have to submit proof of a marriage certificate. So just to review, number 1, number 2, number 5, number 10, number 12, number 13, and number 15, you do not have to provide for this application. All of the other ones are dependent on what you marked on the application that you may need proof to submit. Questions on that? And after that, you're done. So what needs to be faxed in is pages 1 through 8, because it does tell you to list the items that you've included. Page 1 through 8 of this application and any supporting documentation needs to be faxed to the Bureau of TennCare for this application to be processed. The Bureau of TennCare has up to 45 business days to process this application. So it is a little bit longer than Social Security. Now some of you may have, I kind of want to avoid these questions because this is a bit more advanced level question that we get to during update trainings and things. But some of you may have questions about the renewal packets that are going out for the Bureau of TennCare. I'm going to respectfully ask you not to ask me those questions during this part of the training, but you are more than welcome to either email me directly or we can talk about that off training if you have specific questions about that. Because I don't want to confuse people who don't know what a renewal packet is. And then, oh, sorry, page 9 is your rights and responsibilities. So this can stay with the Medicare beneficiary. It just kind of tells them what to expect through the processing of the application. All righty. So does anybody have any questions for me? All right, well, there's no questions now, so I'm going to go ahead and stop the recording.